Welcome to Just Leadership USA's Live with Just Us, our monthly Facebook Live discussion series. I am Ronald Simpson Bay, the Director of Outreach and Alumni Engagement for Just Leadership USA, and the host for today's session. Just Leadership USA is a national criminal justice reform organization committed to decarcerating America by educating, elevating, and empowering the people and communities most impacted by the criminal legal system and systemic racism. We will empower them to drive, amplify, and sustain the kinds of policy reform that builds thriving, sustainable, and healthy communities. Although we are national in scope, we are local in impact. Despite the fact that incarcerated people face some of the highest risk of infections from COVID-19, they were excluded from state vaccination plans across the country against the advice from advocates and medical experts. As part of our JustUS campaign, we are calling for lawmakers across the country to educate and prioritize incarcerated people for the vaccine. And for today's discussion, we are honored to be joined by the amazing community advocate and organizer, Chastity Bowman. She's the president and founder of Opportunities People's Justice Leaders. The always knowledgeable and impactful Dr. Mark Stern, correctional health care expert and general internist. And the always venerable Dr. Homer Venters, former chief medical officer of the New York City jail system and current member of the Biden-Harris COVID-19 Equity Task Force. And I am so honored that you guys could join us for today's conversation. And to those of you out in the audience that are listening, if you have questions and comments you would like to make and have our guests address, feel free to put them in the chat box and we will have them answered by our esteemed guests. At this time, prior to jumping into the questions, I would like each of our panelists to take 2 or 3 minutes to introduce yourselves so the audience kind of get to know who you are and have a feel for who you are. Chastity, would you go first, please?
Sure. Thank you, Ronald, for this opportunity to be on this amazing panel today with Mr. Stern and Mr. Homer, should I say. My name is Chastity Bowman. I am the president and founder of Opportunity People's Justice Leaders, formerly Ohio Prisoners Justice League. Here in Ohio, we fight for the humane treatment of those that are incarcerated in all 28 facilities, as well as working with our national partners across the country to make sure that those that are incarcerated receive everything that is within their rights to do and serve their time in the best form or fashion that they can, and make sure that it is done properly in the way that the state has mandated that it should be. And we have been in operation for a little over a year now, and so that's who we are, and that's what we do.
You were mute and I was mute. So thank you. I'm Mark Stern. I'm a correctional physician and internist. I'm a former medical director for the Washington State Department of Corrections and have been medical director in some other states and in jails. I'm also faculty at the University of Washington School of Public Health, and I spend most of my time these days trying to improve the quality of care, what we call patient safety, for people who are incarcerated in jails, prisons, and ICE detention facilities. And as you can imagine, it's a big job, and it's a high hill that we have to climb to get there. During COVID, I've been working with police and sheriff agencies around the country, trying to help them understand this complicated disease, because it's tough for people who don't do healthcare and medicine and public health on a regular basis, helping them to navigate the water to help them do the best job they can for taking care of this population. So thank you very much for inviting me.
Thank you for being one of our guests. Homer?
Hi, everybody. Homer Venters. Just thrilled to be here, both with the fantastic panelists, but also with Just Leadership USA and the many, many people and organizations that really support the incredible mission of Just Leadership USA. So I'm a physician. My background is in correctional health. Most of my career has been focused on not just trying to improve the quality of care behind bars, but to correctly attribute the health risks of incarceration to these places, to these systems. That is to say, when they operate as designed, they often cause health risks, including sickness and death. Certainly, COVID-19 brings that into very sharp focus. I was about a year ago, up to a year ago, I was running a small nonprofit and stepped aside so that I could just do nothing but focus on responding to COVID in jails, prisons, and immigration detention centers. So I've been in about maybe 24 or more of these facilities in the last year doing inspections, sometimes for the detaining authority, but often as part of litigation or as part of a court-ordered inspection. And the first stop for me is understanding what people who are detained have to say, what their true experience is. And every time I go, I continue to be overwhelmed by the 180 degrees of separation between what people experience and what the official word is about what's happening behind bars. And so that's a focus of my mission as a physician, to bring my kind of very minor technical skills to bear on behalf of finding out the truth and advocating for better outcomes. And I'm really happy to be here. So thank you.
Thank you. And we're happy to have you here. So I'm going to pose my first question to Chastity. Chastity, could you help us understand what is the experience for those who are currently incarcerated during the pandemic, and what kind of care is being provided to those behind bars who have contracted COVID-19?
Yes, absolutely. So in March 2020 of this year, our organization began advocating strictly concerning COVID inside of the facilities. We were concerned about how the state would take a proactive approach towards COVID and our loved ones that were incarcerated across the state. And what we were finding were the men and women were afraid to speak about having symptoms. They were afraid to, if they were sick, to let someone know that they were experiencing COVID-like symptoms, because the process that they go through. So in the prisons, and we're finding this across the board as well, just not in Ohio, we're finding this across the country, that they go into 14 days of quarantine. Well, 14 days in quarantine is like 14 days in solitary. They go into a cell all alone by themselves, and they're isolated. They'll get a temperature check daily. Once a day, they'll get a temperature check, but they are left there to either recover, as the term that the state uses, to recover, or they become critical and go out to the hospital. But they would have to be very critical, like almost near death critical. And so they go into this quarantine state for 14 days. They do not receive any medicine. They do not receive any proper medical care that we're receiving as civilians. I myself, I am a COVID survivor twice, and I know what it was like to have it and have medicine. And it was very hard. So they suffer because they don't have the proper care that they need to fight the virus. And so we've been seeing, in the complaints that we took in last year, we were seeing men and women who were taking care of each other. They just felt like they would be better off trying to nurse each other back to health. So those are some of the things that we are seeing across the board in this country concerning COVID-19 inside of our facilities.
Wow, that is powerful, and I'm glad you're a survivor twice of COVID, and that's almost unimaginable. Thanks for sharing that. Homer, I'd like to ask you, what is access to healthcare like behind bars, and how has this worsened COVID-19 outbreaks in facilities across the country?
Thank you. So I think that, Chastity just gave a really deep insight into what's happening behind bars when COVID hit. I think one of the least told stories of COVID is how inadequate healthcare was before it even showed up at most of these places. So most places have systems on paper for instance, sick call, which is the ability to write down, I have a medical problem, or tell somebody and get care for it. Most of the places that I investigate had deeply dysfunctional, flawed, failing sick call systems before COVID got there. So then imagine what happens when there's this new demand on that same health system. Same goes for chronic care. really woefully inadequate access to chronic care. Many people who, for instance, in the community use 2 asthma inhalers, one for everyday control, the other for emergencies. They show up in jail and they only get one, the emergency inhaler. They use it every day. So I think we all could understand that that puts you at just incredibly heightened risk, not just for having asthma, but for having poorly controlled asthma before COVID even becomes an issue. So these dysfunctional health systems exist because we decided it was okay to carve them out from the responsibility of our public health structures, like our state departments of health, like the CDC, like other CMS, other organizations that are evidence-based. And so one of my missions now, and I'm speaking obviously just as in my correctional health role, not as my role on the task force, but one of my bigger missions is to see if we can leverage the fleeting interest of the CDC and departments of health in COVID behind bars and use that and keep them there so that we can address some of these other longer standing issues and save many more lives.
That's so powerful. Thank you for sharing, Homer. Chaz, I have a follow-up question for you, and I'm just curious, what are some of the fears and doubts people behind bars have about receiving the vaccine?
Well, their fears and doubts are much like ours, but they're a little more amplified because they don't have the proper education concerning vaccination, what it is, what it's about. All they have is the news and the propaganda and what they see. And so they're afraid that they're going to be experimented on. They're afraid that if they suffer a reaction to the virus, that they will not receive any proper medical care to help them with any reactions to the virus. We did a survey last month asking those incarcerated how they truly felt about receiving it. Did they want to receive it? And it was kind of a 50-50 split. A lot of the men and women said that they didn't want it. A lot of them said that they did. So there's an issue that's being raised. What will it be like for those who don't want the vaccine? Will they be mandated to take it? If they don't take it, will they be reprimanded for not taking it? And so there's so many misconceptions swirling around it. And we're seeing that the DOC and the Department of Justice is just not giving adequate information to those that are incarcerated across this country concerning the vaccination. They're not really telling them anything at all concerning it. And when you hear talks about it in the media or from the departments, you just don't hear anything concerning the incarcerated population. So that makes it very stressful for families. Because along with the 2.3 million that are incarcerated in this country, there's 2.3 million families that are standing behind these folks that are incarcerated, and it puts a lot of stress and worry, and then it overloads advocacy groups because we don't have the answers either.
Wow, that's and you said misinformation and misconception. And it made me think of another question. Any of the panelists, any of you guys could answer, and I'm wondering: has there been any effort to inform the incarcerated people that this is not your traditional vaccine where you get injected with the actual viruses to help fight, to build up an immunity to fight it off, but this is a totally new category of vaccine that's been created that isn't based on injecting you with the actual virus? You guys have any kind of knowledge or information about what that's being shared with the people inside?
Not as far as I know, not in a uniform way. There are some pockets that are working on it. I'm working on it with some folks here. And actually, Ronald, this might be an opportunity to share something I told you about earlier that would amplify what Chastity told us about. Was this a good time for you?
Yeah, okay. Sure. Go ahead.
Let me... So this is very much in line with what Chastity was just saying. We surveyed about 5,100 people in jail and prison around the country with a lot of help from a lot of volunteers. And as you can imagine, it's hard to do this kind of thing these days. And in general, this was the response. About less than half the people said that they would take the vaccine. Almost half the people said they wouldn't. And then there are about 10 or 15% in the middle that are not sure and are waiting. And what's really important is to compare this against the population and the community. So again, this is these are the people in jail and prison, the number of people who would say yes. And these are in a couple of other studies, these are the number of people who said yes, they take the vaccine in the community. So we really are fighting a challenge, as you point out, Ronald, of trying to convince people in jail and prison of the importance of getting it. And we also looked at this yes and no by a number of things, but including race or ethnicity. And at one end of the extreme, Hispanics were very much more likely to say yes, that they would get it. Blacks were much less likely to say yes, and Native Americans and whites somewhere in the middle. So it clearly shows this disparity with regard to color and the challenge that we have. And finally, it made me think of it with what Chastity said of what were the reasons. So we've started to look at some of the reasons, and the big four where people had concerns about how well it works, and concerns about safety. They were a bunch of people were waiting for more information. In other words, at your point, Ronald, that they haven't been getting enough information. There's a large amount of distrust of everything, of healthcare, and for the reasons that Homer mentioned before, there's this long history of not providing good healthcare. So why, when the doctor or the nurse in the jail or prison comes in and tells me I should get a vaccine, why should I trust them? Distrust of the jail or prison, and just distrust of government in general. And unfortunately, about a quarter of the people felt that it was or about a fifth felt that it was unnecessary. Those are the main reasons. There were a bunch of people who just don't believe in vaccination, never did, don't get any vaccines. And then there is, again, unfortunately, some people who feel that vaccination is part of a major conspiracy. So I just thought I'd share that. It's really informative, and it outlines the work that we need to do, and the answer to your question of what information we need to provide them to increase the vaccination rate. I think there's a tremendous role for your audience, people listening to this, the people like Chastity and others who are communicating with people on the inside, and where those people trust us. They trust their family, their friends who are making contact, and they look to us for guidance, because if they don't trust the jail, they do trust their friends and their family. And so we can really have an impact, you and me and those of us in the audience, of helping to explain to people why they should get vaccinated for their safety, the safety of the people around them, the safety of the community.
Yeah, you made a great point about the anti-vaxxers and the conspirators. It's like they create a huge barrier to this process moving forward, and I hope we can kind of do something to convince them as well. I guess my next question is for both you and Mark, Homer, both you and Mark. We know that the pandemic is far from over. What is the importance of vaccine access and continued preventative measures, especially for incarcerated people?
Homer, you want to take first stab?
Sure. So first, I'll say that in many of the places I'm going now, prisons and jails and immigration detention, really just in the last couple of months, many of these places, things are getting worse, dramatically worse, because there's a lot of fatigue around imposing infection control measures that, as Mark said, these are systems that were really never built for infection control, because staff have been sick, and in many DOCs, prison systems, you have really even higher rates of unfilled lines, and so you have real baseline problems with safety and ability to get basic health care. So things are getting worse in many of these settings. So we must prioritize these, and we have to be honest and just say, if we think that we need to prioritize congregate settings, that these are congregate settings, and there's no excuse. There's no you can't talk on one side of your mouth about congregate care settings, and on the other side of your mouth fail to explicitly mention jails, prisons, immigration detention centers. The other thing is, we've loaded these places up with incredibly high-risk people, individuals that are at high likelihood of dying if they get COVID. And so prioritizing vaccine for those individuals is crucial. But many of the interventions that the CDC rolled out, a lot of them back in March, to slow the spread, to help find and manage cases of COVID-19, many of those systems are just in tatters in these facilities that have become overwhelmed or fatigued. And so the only path forward to address that is not just access to vaccines, but much more robust and ongoing involvement of real public health organizations in these settings.
I'll echo what Homer said. Saying it a different way, there's a double whammy for this population. They're in a place where they're more likely to get infection. As Homer said, they're sicker to begin with. They have more of these underlying diseases, so it's a double hit. And I think one of the urgencies also for us to double down on our efforts is the emergence of variants that may spread more easily, and we don't know, but in some cases the vaccine may not work as well, and so there's a rush. If there was a rush before, there's even more of a rush now, and an urgency, importance for us to help these populations get vaccinated. And the other thing that we haven't talked much about is the most important, the most valuable way of improving the health of folks in a congregate setting is for them to not be in the congregate setting. And places that have downsized their prison population or jail population have reaped some benefits from that, and vice versa. In places that we've seen, and this goes back to Homer's point about fatigue, places, especially jails that did downsize, in those locations where they've started to relax and said, hey, the curve is starting to change and we can start to arrest more people and pack the jail again, those kinds of jails are getting burnt. They're finding that all of a sudden they're having more infections that they didn't have when their size was much more manageable.
Wow, that's very important information. We have a question from the audience. I'd like the doctors to speak to, if they would. It says, how can we be sure of the safety of these RNA vaccines and what kept them from being rolled out prior to COVID-19?
First of all, they weren't rolled. They've been worked on for a while. They're not new. The laboratory work on them has been going on for years, but it was accelerated due to a need. And I think it's unfortunate that the fact that this was done quickly makes people think it was done sloppily. It was done quickly because we invested an unprecedented amount of time and energy and money in the last administration into getting this done quickly. One of the most important ways in which we cut down the amount of time that I think people don't realize, that people who I've spoken to in jail and prison, is that they think corners were cut. And one of the main things that was done that was not a cut, it was a corner cutting in a way, but a smart one, was to say, we've got these vaccines that we've got in development. They're in the laboratory. We're doing experiments. We're trying to figure out if they work. We think they will. So we're going to ask the manufacturers to go ahead and start to produce these vaccines before we know whether they work or not. And that was a key step that the government took in getting these prepared. Now, it was a big gamble, because if the vaccines did not prove to be safe, all those manufactured vaccines were going to be thrown out. So it was a really big gamble, but it turned out to be a worthwhile gamble. And that's where we cut out a lot of time. It wasn't by saying, well, let's just ignore side effects, or let's not do some of the experiments we need to do. That was done. It's just that we saved a lot of time in manufacturing.
Okay. And, Homer, did you have anything you wanted to add to that? Thanks for that, Mark. Appreciate it.
No, I think I would just point out what actually you pointed out at the beginning, which is, these are vaccines that are not made with pathogen particles or inactivated pathogens, so that they're not infectious. That's the one thing that I tell people that I think is important to know. There's a lot that's different about how they're made. There's a lot we still need to understand going forward about how we could use them potentially in other vaccines. But right now, as Mark said, we have been able to follow safety protocols that certainly give me good confidence in getting it, in recommending it for people, and thinking that this is a life-saving intervention.
Okay. This is the question for all the panelists. How can those of us on the outside continue to advocate for incarcerated people through this pandemic?
I think the way we can continue to advocate, our organization is always looking for volunteers. To this day, we call every facility every day to do what we call wellness checks. We're always looking for volunteers to do that. Just last week alone, we did a round in all of our facilities, especially Franklin Medical Center, which is our medical facility, trying to figure out what is the plan, especially for those that are at risk in Ohio. According to the annual report, 21,000 people were at risk, which means that they fell under the CDC guidelines for having underlying conditions that would make them very susceptible and could be fatal to COVID. And so we called Franklin Medical Center, and we were really concerned about that population because you have a lot of people in the medical center who are diabetic, who are elderly, who have these underlying conditions, and that we're very, very concerned about. Not saying that the rest of the population isn't as important, but that really helps, because what it does is it lets the facilities know, and it lets the department know that there are people out here that care, that will hold you accountable to everything that you say. And we see a lot more movement when we make these calls. Just something as simple as picking up the phone, volunteering an hour of your time to do that, educating yourself concerning the vaccination. If you are a loved one of someone who is incarcerated, get more education on the vaccination. Even if you don't plan to take it, or you do plan to take it, at least ease your loved one's mind and let them know the pros and the cons, and try to help educate them a little bit more concerning the vaccination, because it's very important. They don't get, as I said before, they don't get the same information that we do on the scale that we get it. So that's how the general public can help, is just putting the information out there in their hands. And if anybody would like to volunteer with us, you can find us at OhioPrisonersJusticeLeague.org. Fill out a sheet to be able to help us and volunteer and help us call some of the facilities, even in your state. We can show you how to do that.
Fantastic. Thanks for the opportunity. Mark or Homer, do you guys have any thoughts on that as well?
Yeah, here's something else to do, and this will pivot off something Homer said earlier about how a lot of local and state governments have not prioritized this population properly. And there's two errors. One is that they haven't prioritized them, and the other thing that we're finding, that I'm seeing, is that even when the incarcerated population is prioritized to get the vaccine at a certain point, the distribution doesn't always match that priority. That a jail was supposed to get a certain amount of vaccine, but they didn't, even though they were on the list. So I think that translates into two things that the audience can help with as advocates, beyond just, as Chastity's saying, work directly with the population, is working with local and state government, is having your voice heard. With the local government, you're generally in the hands of the local health authority or local health jurisdiction. In other words, the county health officer is making sure that they are including the jails and prisons and ICE facilities in their community in the plan. Now, generally, ICE and federal facilities are being taken care of by the federal government, so that is that's still important, but the local officials have much more of an effect on the jails and to some extent on the prisons. And so the second place to be putting pressure is on the state government. Mostly this is in the hands of the state health department and governor to establish the priority. So have your voice heard that this population, as we've been saying, is at high risk. They can't do all the protective things that you can do in the community because they can't separate necessarily. They don't always have the materials they need. And therefore we have a responsibility to them. So they should be properly prioritized, and they should be getting the vaccine. So sending messages, again, to summarize, to the local public health officials and to the state public health officials and governors, make your voice heard and tell them how important this population is.
Homer, did you have anything you wanted to add? That was great. Thank you, Mark.
Yeah, I would just even put one extra plug in for the need for specific engagement resources. So to really engage with people who are behind bars on the importance of vaccination. And when I say engagement, I mean using credible messengers. So people that are currently incarcerated in the same place that can be partner with the health service, bringing in people from the community that can deliver that message and be effective. People have very good reason not to trust these health services often. And the other thing is there's a narrative developing as I go around the country that the correctional facilities will say, well, people don't trust it, or they believe a conspiracy theory or something, which may be the case, but then that's the end of the conversation. And in the community, that's the beginning of the conversation, because we all understand that we have to engage with people to promote acceptance. So we need to devote resources, money, staff, time for engagement with credible messengers in all of these settings, if we really want to maximize vaccine uptake for individuals to save their lives, and also to end the pandemic.
Thank you, Homer. We have a question from the audience. It kind of goes to what you mentioned a little bit earlier, Mark. What do you think is the role of non-government people and government people at the federal and state levels to promote equitable access for people that are incarcerated? Who wants to take that one?
Well, I can just say that as I've said, often, I think that our public health and health organizations that care about and promote health in the community, in hospitals, nursing homes, schools, those are the structures we need involved in these places. So, and it can't just be that the CDC shows up for a brief period of time to occasionally help manage an outbreak. It's that state departments of health, local departments of health, and the federal government should be coming up with tools and figuring out, do any of these guidelines get followed? Is anybody doing any of the things that the CDC has said since March should be done? And to figure out, what are the true harms, health harms of incarceration? We know all this information from the CDC about traumatic brain injury in youth sports, but a place that traumatic brain injury is much more common is incarceration. And they don't spend one single dollar on tracking or preventing TBI behind bars. That's a great example of the hypocrisy that's really rooted in racism in our country, that we have to leverage our public health structures, national and state, and right now is the moment to do it.
And it's that I see that that question is from Cesar, who himself has contributed to this effort, and thank you for that work and for the question. Yeah, I agree with Homer. One of the I would almost say the first, second, and third underlying problem of healthcare in our correctional system is that it's underfunded. When you look at the amount of money we spend on healthcare of folks who are incarcerated, and then how much we spend even with something as a payer like Medicaid, I believe we spend a lot less, and we get what we pay for. So the role for advocates, for non-government and government agencies, is to increase the funding to be at least comparable. And if it it needs to be more, because this is a sicker, more complicated population, and it's more complicated to provide the same care forget about COVID, for a headache. It's more complicated to provide care for a headache in a jail or prison than it is in the outside. You can't just go to your medicine cabinet in most jails or prisons and pull off the aspirin and take it. You have to go through this so it's just a more complicated setting, and it requires more funding. And the role for us is to be the gadfly with our state agencies and our federal agencies, of saying this is unacceptable. We need to provide comparable care to what is to the care that's provided in the community. And there are some other agencies around that you can help partner with. One of the ones that I think can be very helpful is the disability rights groups. Most states at this point have them. They are becoming more and more involved in the correctional population, realizing that they have disabilities that come under the ADA law, and that those needs are not met in many cases. So I think that's an example of a kind of organization that we and your audience could partner with to amplify their efforts.
That's definitely relevant. Homer, you mentioned the CDC, and I'm just hoping that under the current conditions with the new administration, that the CDC doesn't feel pressured to, give advice that may not be the best advice for us, because we saw some back and forth during the last administration of them changing their positions on, what is proper for treatment for this pandemic. This is a question for all the audience as well. For all the panelists, what must change within correctional healthcare? What do you guys see as the biggest obstacle in correctional healthcare to this process?
I think for me, and I'm going to play the devil's advocate here really quick, because it wouldn't make a good panel if somebody didn't, right? So, I think for me, as far as healthcare, we just don't invest a lot of money in it, especially with Medicaid, and some of the copays that some of the people are seeing. It doesn't make sense. And so what we've been seeing is there's no healthcare. They say that there's healthcare, but there's no healthcare. It's it's extremely minimal. If we're speaking on healthcare as a whole, there shouldn't be folks in our facilities who are losing limbs and don't have the proper care to heal from them, don't have the proper medicines to be able to um, to take care of themselves. I mean, it's really, really unheard of. And I think if we don't speak to what's not happening in the facilities, then are we really speaking to the problem? Like, are we really truly speaking to the issue? Just one really quick example. I had a family call. There was a gentleman, 21 years old. He had been complaining for 2 weeks that his stomach was hurting. He had had sick call after sick call after sick call after sick call. And finally, when they did take him to the infirmary, two of the gentlemen in his pod had to carry him there. When he made it there, they rushed him out to OSU. His something in his stomach burst. Now he is 21 years old with a colostomy bag, and he'll wear that for the rest of his life. But had someone listened to him and took immediate action when he needed it and gave him proper health care when he needed it, he probably would not have that. So now his life has changed. And these are things that we're seeing with healthcare. I have personally heard on the phone the rapport that nurses have with those that are incarcerated, the rapport that nurses have with families when they call just to merely check on their loved ones, the lack of concern that they show, the lack of information that the department is willing to give to families. I have had several families we have serviced during COVID that did not know that their loved one had passed away due to COVID for at least 30 days. They had no clue that their loved one had died. So we have to bring to light these things. We have to speak on the things that aren't happening in order to be able to fix the problem. Yes, we can voice to our local government, to our state government, but in 2020, in Ohio, we put 1,500 medical reprieves on our governor's desk to ask that these vulnerable people that are incarcerated be released, sent home. He sent home less than 300 people out of 50,000. So trying to convince folks that a vaccination is the answer is very hard on the advocacy side, because we haven't seen any movement in just the regular care concerning those that are incarcerated, the incarcerated population. And so, like I said, we have to speak on the things that aren't happening in order to change, to see a change and to make things happen.
Thanks. That's the advocacy side is definitely well represented. Thank you for sharing that. And Mark and Homer, you guys have anything from the governmental or medical side that we could be thinking about what must change within the correctional healthcare system?
I think we've been hitting on a couple of answers over and over again to emphasize them, and Chastity just hit them, at least one of them, and that is money and size. We get what we pay for. We don't spend enough money on healthcare, and the population in jails and prisons is overly large, and those go hand in hand in the sense of if we can't spend any more money, if we reduce the population, by default, we will have more money per capita, per person, to be able to spend on the healthcare that they need. And the folks who are in jail and prison are sicker than people in the community. And I'm not talking about COVID. I'm talking about heart disease, hypertension, asthma, drug abuse, mental illness. We have more people in, everybody knows this, more people in who are seriously mentally ill and are incarcerated in prisons and jails than we do in community mental health institutions. So I think the two-prong approach is reducing the size and increasing either relatively or absolutely the amount of funding that we put into healthcare. Homer?
Yeah, I think for me, a lot of my focus has been on the fact that we don't measure how and when incarceration harms health. So we do spend a lot of emphasis on, people have a lot of health problems, and it's true. But for instance, when people fall out of the bed in a nursing home, there's a report written and there's a record made, and then there's you can look and see how often do people fall out of the bed in nursing homes. When you get an infection from a central line catheter in the hospital, or if you don't get to the cath lab, that gets measured and systems are held accountable. In correctional health settings, there is no measurement of how the system confers health risks to people, and we must develop that. That is important not just to improve the quality of healthcare, but it's important for undoing mass incarceration, because there are important voices in our country that are not part of the discussion about undoing mass incarceration. So take health insurance companies. If health insurance companies truly understood how much work and expense is involved in fixing up or caring for people who are coming out of jail and prison, and we could quantify how many jail attributable deaths there are, how many jail attributable hospitalizations there are, that would bring other voices, important, powerful voices. So at Rikers, we developed this metric, jail attributable death. Every time somebody died, we would look and see, did something that happened behind bars significantly contribute to this outcome of death? We should do that with every death in every jail, prison, and immigration detention center, but it never happens because we don't want to measure, and ultimately we don't want to address how these systems harm health.
Absolutely, absolutely. We have a question from the audience, and Mark, maybe you can address it because it's a graphics question. The person, Shannon Ross, is asking, I guess they're trying to create some graphics to share with people incarcerated on this whole process of how the vaccine was created. Why is it speedier now than before? And because, a lot of skepticism of the incarcerated population around the speed of it, and not just that population, but, the Black community in general, they're suspicious of the speed in which this was created. So do you have any suggestions or any materials that you could share with our audience and Shannon around creating graphics to show how this process was done and how it's being done now?
There are some, I'm pretty sure, and I haven't seen it, maybe one of the other panelists knows, or you guys do, the Prison Legal News produced something that in California advocates are sharing with people who are incarcerated that has some of that information. So I will look for it and share it with you, Ronald, then you can put it on your website and share it with the audience. I don't know when you say graphics, I think the information, it doesn't necessarily even have to be in illustrated form. I think the information, even in verbal form, of saying some of the things that we've been saying today, that the vaccine, as Homer pointed out, it's not a virus that's in the vaccine. That's an important one. I did the surveys and talked to people, that was a major concern. And
Yeah.
when they understood that there is no virus in the vaccine, it put them at ease. It was just simply that statement. They didn't have to see anything more visual than that. So sharing some of those key points about how the vaccine was produced quickly without danger, how it doesn't have virus in it, how it's been tested on tens of thousands of people, how the side effects are being monitored. I think those are the messages, but I will look to see if there's some material and share it with you, Ronald.
That's great, because the person that asked the question, Shannon, said they were just, general writing material about it as well. So that's very helpful. And anything you have, you send forward to us, we would share with our audience. The next question is one that's been on my mind as well. How can we call on lawmakers to act to prioritize access to and education for incarcerated people, and what must be done on the state and local levels to address this issue of the pandemic in jails and prisons?
I think the answer is in the question. Just do it.
Yeah.
Just be, I hate to say annoying in a public forum, but be persistent, write letters, make phone calls. And, And it's not just about the pandemic. As Homer said at the beginning, we started with a broken system, and it just made it more broke. If you couldn't provide, if somebody with shortness of breath couldn't get good access, quick access to quality healthcare before, how in the world do you do it with all the other constraints that are on us now with the pandemic? So it's the underlying system that is broken. We have to work on COVID and give it attention, the focus should be on the underlying system at the same time, because without that, no stress on top of it like COVID is going to have a good outcome.
Anybody's got any thoughts?
I echo Dr. Stern. Just do it. Just do it. Put the pressure on your departments, put the pressure on the directors of these prisons, follow the money trail, put the pressure on where the money's going, where it's coming from, just do it, reach out to your representatives, your senators, your legislators. It's just all about accountability, and the more you do it and remain consistent in doing it, I believe that we could see results.
Well, thanks for that. I would also add in what Just Leadership is doing around this particular process. As some of you may or may not know, that last June we launched the JustUS campaign, and this Facebook Live presentation is part of that campaign. And what we seek to do is enact emergency management legislation in every state across the country for jails and prisons, for the officials to deal with not just the pandemic, but any natural disaster or emergency that's declared by the federal government. And if you go to our website, JustUSA.org, and click on it, you'll find the JustUS campaign page. And on that page, you will see a sign-on letter. If you click the letter, and put your information in, it'll automatically tell you who your representatives are, and it'll send a letter on your behalf to those representatives. They tell you how to get involved with our campaign to help get the word out around the pandemic and how to address it in our jails and prisons. So if any of you looking for ways to be proactive in addressing this situation, visit JustLeadershipUSA.org and join us. Text to join, as David has here, 55872. We would love to have your participation. And I'm gonna circle back to the doctors, back to the vaccine question. One of our audience is asking if the vaccine doesn't contain any of the virus or dead antigens from the virus, what is it? What is the I guess the working portion or product within the vaccine that's being so effective? What is it made up of?
We can either of us can answer that. I'll get started. The vaccine contains the instructions for our body to make particles that look like the virus again, and then our immune system can start to build up immunity to those particles. So we're giving our body the instruction to make an avatar of the virus. Homer, you wanna?
Yeah, I think that's right. I mean, I think that I sometimes think of mRNA, we talk about them as mRNA vaccines, as kind of an instruction to cells, like tell the cell what to make, what to build. It's like you get your IKEA instructions and it says build this. Well, the mRNA vaccines are telling the cells to build something. So it's not a part of the pathogen itself, but it's an instruction manual for the cells. And what we're telling them to build, as Mark just said, are antigens, things that can trigger the part of the immune system response that we think is going to protect us from this infection. And it turns out that the vaccines that have been approved have been through all this safety review to do just that, so that we know that they're both, you hear a lot in the news about how we evaluate if they're effective and if they're safe. And so the safety work usually comes first, and then the efficacy work after that. And so that's kind of how I would describe how they function.
That's very helpful, because I've always wondered about that myself. I've done some research around RNA and DNA, so I kind of understand the difference personally, but I think it's helpful for the community to have some type of working knowledge on, how the vaccine works, because most people know that their knowledge of vaccine is being injected by the pathogen itself. So thank you for sharing your thoughts on that.
There's I just add another piece here that I think could help address some of people's concerns. One of the reasons that mRNA vaccines have been so long in coming is that mRNA doesn't last very long. It's not what we call stable. Proteins, an egg is protein. That protein, you put it in a pan, it sits there, it's fine. mRNA doesn't last very long in the body once you make it. And so one of the good things to know about it that helps allay some of people's fears is the mRNA disappears very quickly. It goes into the cell, as Homer said. It does not go into your genes. It doesn't change your DNA or your body's makeup. It simply gives this instruction to produce the protein, and then it vanishes very, very quickly. So that's one of the things that I think would help people understand its safety.
Thank you for that. That's a great clarification. So we down to like the last 5 or 10 minutes. So I would like to, I'm watching the chat box. If the audience has any further questions, feel free to jot them in and we'll ask them. But for now, I would like to give our panelists the opportunity to give some closing thoughts and even a call to action if you have one.
I think really quick, if I could just speak to something, because I almost forgot and it came across my brain, to the doctors. So a lot of questions that we're having from those that are incarcerated, a lot of the population has contracted the virus, as we know. So their biggest concern is if they have contracted the virus already, they've recovered. What will the vaccination, they're afraid of, because they've had it and then they get the vaccination, that there will be an immediate adverse reaction. Could you speak to that to give us some clarity on how, I know we just spoke about how it works, but could you speak to that to give those who advocate and families, so we can relay that back to those that are incarcerated to kind of ease their mind on that subject?
I don't know of any risks to being vaccinated after having had the infection. In fact, the CDC recommends that people get vaccinated. About the most, as far as we know, again, we're learning every day, and something that we say today may be proven wrong tomorrow because we're all learning. But if anything, we think it will boost the immune system and make it less likely that you could get infected again. There have been very few reinfections, but it can happen. And we also know that as the variants become more common, the chances of getting infection may go up. We don't know for sure. But getting a vaccination is, so far all the information shows that even if you've been infected, as long as you wait the appropriate amount of time to get the vaccine, that it is safe.
Any thoughts, Homer?
No, I would say that, as Mark said, it's safe to get it afterwards. We generally don't want people who are currently, having a current infection to get it. We want them to wait till they get better. But once people have cleared that acute phase, it's safe to get it. And we think it's very helpful because we still don't know how long this immunity lasts. Or like Mark said, the immunity you have, from having had COVID before, how protective that is against the different variants as they come in. So we know that it's possible for people to get reinfected. And so we think it's an important step for people, even if they've recovered or they feel like they've mostly recovered from COVID, to go ahead and get vaccinated.
So what parting thoughts or calls to actions or anything would you like to share with the audience, Mark, Homer, either one of you guys?
I want to go back to a theme that we've all been hitting on, and this is bigger than COVID, and that is the need to improve the conditions of confinement, especially healthcare in this environment. And Homer, I think, knows more about this than I do. I'm sure he does. But there's a movement afoot in Congress, has been, and I think it'll be come up again in the new Congress, to provide Medicaid funding for part of all of the care in corrections. Currently, Medicaid does not for the most part, doesn't go into jails and prisons. And that has a lot of repercussions, the amount of money, and also oversight. Homer was talking earlier about accountability. And in when you get sick and you go to a hospital, that hospital has been accredited. And it's been accredited largely because the hospital receives federal funds, Medicaid and Medicare money. Without those funds, the hospital wouldn't survive. But with that comes oversight. And that's something that is largely missing in our correctional system that would come hand in hand with Medicaid funding. And so from an advocacy standpoint, which is what you're asking about, I think it's terribly important for us, our audience, to support any legislation that comes up in Congress to extend Medicaid funding to this population. And let me turn to Homer before I give too much misinformation and see if you have anything to add or correct.
No, I mean, I think those are really critical principles that transcend COVID. I think one of the things I worry about, or I want to be very careful about, is, I'll sound like a broken record, but we have to get honest about measuring how incarceration harms health, because unless we do that, we can't really figure out how to right size and undo mass incarceration. So I think that we need more resources for healthcare for sure, but those resources must be dedicated to measuring all the ways in which people are harmed or have health problems when they're behind bars, so that policymakers can really truly understand when somebody goes to jail or prison, what are the potential risks and how is it harmful for them potentially and society. And so starting to measure that, I think, is critical. I think that Medicaid access is important. I think the thing that I would want to really have a very keen laser focus on is that we're not simply giving huge amounts of money over to county sheriffs to do with as they want, that we're not going to absolve them of some of the critical standards of care that Mark was just referencing.
Chastity, you got anything you want to close out with or call to action?
I'll just echo what they said, and I will amplify the JustUS campaign. It is strictly geared towards COVID. Get in there, write that letter to your legislator, and consistency is key to this. We have to educate the population and decarcerate the population so that we can heal it, because as long as there's COVID in our prisons, it'll always be COVID in our societies. And that's true. That's my true statement that I hold on to. So we can't continue to neglect this issue, just not COVID, but just the broken healthcare system inside of our facilities. We can't continue to ignore it, because at some point, these men and women are going to return home. Mm-hmm. And then what's next there, So I'll speak to it and leave it there.
Absolutely. I mean, I always say by definition, jails and prisons are super spreader events because they can't social distance. They don't have access to all your PPEs, your personal protective equipment, what have you. So definitely join the JustUS campaign at jailusa.org and help us get the word out there. The more letters we have, the more impactful we are. And we hope that we can decarcerate America and make America safe again. So I give thanks to my audience for joining us. I give special thanks to my esteemed panelists. You guys make us look good, and thanks for taking the time out your busy schedule to speak to us, to speak to our audience, because you give us credibility and you give credence to the movement. Homer, do you want to add something?
No.
Okay. Well, with that being said, we will sign off here. We say goodbye to everybody, and we'll see you in a few weeks on our next JustUS campaign. Stay tuned and join us for the next one. Be well, everybody.